COVID-positive patients, I'd be interested in any therapies, hydroxychloroquine or other antivirals or antibiotics, and when you start and what doses.
对，这另外一个问题。
By the way, you are muted.
muted.
It's muted.
You are muted.
Wait a moment.
Okay,
Okay, good.
is that okay now?
Use that
Yes,
microphone
yeah.
over there on your right.
Okay.
Okay.
According to the guidelines of Chinese government for COVID-19, they recommended in the seventh edition, they recommended some broad spectrum antivirals to use, especially specific at the initial period of the disease. However, as you may also know, all the published randomized study of antivirals haven't changed enough capacity to be efficacy to be used in this virus. So our viewpoints, as in our medical team, is that antivirals, if there's any candidates or or efficacy, may only be used at the initial period of the infection, the initial stage. As we observed from our patients, as we are treating almost all the critically ill patients, in the late stage, the changes in the patients, like multi-organ injuries, are not only caused by the direct injury of the virus, but also by other indirect effects from the body. So we think that at the late stage, antivirals may not have such a big effect. For the question of chloroquine, yeah, it is also mentioned in some studies. The most recently published study was one published this year, which was an in vitro study showing that this drug may have efficacy in vitro. However, this hasn't been tested broadly in human beings. There is one small study, but it was not controlled nor randomized, showing that this drug may have efficacy in mild-type patients. But just as I mentioned, it is not randomized, it is not controlled. So the results of this trial is suspecting for me. We are not using chloroquine in our patients right now. So just for your reference, I know that the U.S. has already taken that as one of the triple therapies in your mild or common type of patients.